Obi Light turned a personal call to action into a movement from classrooms to community clinics. Today, he tells us how education, policy, and grit can change the future of sickle cell care. Stay till the end as he drops one challenge for leaders you don't want to miss. Kindly, Obi Light, can you introduce yourself?
Okay, thank you, Pius, for having me. My name is Obi Light Ogbonnia. First of all, I'm 51 years old, sickle cell warrior, based in Nigeria, and I'm the founder of the Obi Ogbonnia Sickle Cell Foundation. Obi Ogbonnia Sickle Cell Foundation has been in existence for quite a while now, but for my 50th birthday celebration last March, we launched it, and it became, known to the public. And I'm also the CEO, Vision Trends Network, and the VTN Global Services Limited.
Thank you. That's great. What you've built is something that can connect classrooms, clinics, and policy rooms, all to put patients first. We'll get the origin story, the system fixes he's pushing for, and practical ways you can act. So, when did you first know that you have sickle cell disease, early struggles, and the turning point?
Okay, my mommy told me that I was diagnosed at the age of 3. At the age of 3, my parents were told I have sickle cell disorder, and growing up had been a very difficult one, because my parents didn't have any knowledge of how to manage sickle cell. So it was a problem for me, growing up in the rural community where I was brought up, where you could barely get the hospital. The treatment I was exposed to at the time was just a very small pharmacy kiosk where the man would, mix all sort of tablets, in the name of giving me a painkiller, and that is it. It was difficult. I did everything every other child, did growing up. I had to follow my mates to the forest to fetch firewood. I had to use buckets, go down the stream to fetch water, with heavy buckets on my head. I did practically everything other kids did because my parents didn't know that those stress were all equally responsible for my crisis. So each time I finish training myself, having all these difficult activities, I go back home, with crisis. So it was a difficult, until I got living with my auntie, who is a nurse, the husband, a medical doctor. Okay. At some point in my life, I moved in with them, and they taught me everything I know about how to manage, my health. And ever since then, I have made my bottle of water my greatest company, knowing that I must stay hydrated. That's the first lesson I learned, that I must stay hydrated, So I carry my bottle of water everywhere I go, trying to keep myself hydrated. How I was taught to stay out of strenuous activities. So that is the turnaround of my life, knowing how to manage my health.
So which single moment made you stop waiting and start crafting the Shujaa that who you are today?
Oh, yes. I think the whole turnaround started when the issue of love, was bedded in my heart, and I was like, if I am going to get married, if I'm going to take care of someone's daughter, then I have to change my mindset. I have to be dependable. I have to be independent. I have to be able to take care of myself so I can take care of my wife and probably the siblings that we're going to bring into this world. So that is when I started living a very deliberate life. Okay.
Yeah.
The life of taking care of myself, the life of being responsible, and that is when I got having feelings for other sickle cell warriors, especially the kids, the little ones. I started trying to guide them, trying to put them through on how to take care of themselves. I'll see them playing rough, making all these strenuous activities. I'll call them and say, look, you don't need to engage yourself in playing soccer. Yes, I know you love it, but please just reduce the number of time you spend playing soccer, because it will have effect. So I think the thought of getting married and having a family brought that turnaround of being responsible and thinking of what I can do to support the community and not just living my life.
Really, you're being a Shujaa through empowerment, through you seeing what others did in the environment, and you take that initiative to at least tell them that it's possible through them being self-aware. So the funding with nobody expected, and how did you start crafting that Obi Light Ogbonnia Foundation?
Okay. Yes, I understand. Ogbonnia Sickle Cell Foundation. Like I said, last year, when I was about celebrating my 50th birthday, I gathered my friends. I said, look, this time we have to do it differently. Okay? I've been celebrating birthdays, counting the years. As a warrior, if you pass the age of 30, 35, 40, 45, people start looking up to you. People start looking up to you that, oh, you're lucky. You're getting old. So that 50th birthday, I gathered my friends and I said, look, we have to do things differently. It's not just going to be a birthday celebration. Let us give back to the society. Let us set up a foundation so that we can look after the younger ones coming behind us. So I remember my friends asking me, to give them one of the greatest needs of a sickle cell warrior, and I didn't hesitate to tell them that the greatest need of a sickle cell warrior is access to healthcare, prompt and adequate healthcare. Okay? And they were like, okay, good. In that case, let's provide free health insurance to the less privileged sickle cell warriors. Okay? And agreeing to go into that line. Then the next question is, okay, how many do we begin with? Of course, because I was celebrating 50 years, they were like, okay, let's begin with 50 sickle cell warriors. So now, what are the criteria? We had to look at the age that is most vulnerable, okay? And we said, okay, let's begin with ages below 18, 0 to 18. Let's begin with that to provide free health insurance to them. And we also decided to begin from Abuja, which is the city where I live. Okay, Abuja has 6 area councils, so we contacted the already existing sickle cell foundations in these 6 area councils, and we said, look, we need 50 sickle cell warriors below 18. So you guys have been around, please nominate them. Okay?
Yeah.
If you think that this child needs a free health insurance, nominate them. And it was not long we got that number and more. Okay? And we did the launch and we provided 50 free health insurance to those lucky warriors. And since the launch last year, March 24th last year, the number has increased. In fact, it's nearing 100 at the moment. I think it's about great. 70. Yes, we decided to upscale the number from 50 to 100 this year. So, and that's exactly what we're trying to do. So that is just, and it's been funded by my friends, my company, and myself. No external funding has come in so far at the moment.
That's great impact, and you'll continue scaling more broader and impacting more lives. So when it comes now, education, schools, prevention plus awareness, I have a small task or a small ask, an activity that people can do while on the festive season.
Okay, with our foundation, you mean?
Yeah.
Oh, okay. Last December, we did what we call Secret Santa, okay, where we visited, where we visited some families with food items, okay?
Yeah.
And the reason for doing that is because you and I know that sickle cell causes poverty, okay? And the criteria in choosing the families to visit, we said, okay, let's look at families with multiple sickle cell warriors, which we have noticed around us in Abuja here, that a lot of families have multiple warriors. Okay, so we selected those families with multiple sickle cell warriors, and we visited them with food items. And this year as well, we're equally planning the same, then calling on the general public, the well-meaning supporters, to donate to this cause. Okay, food items, drugs, money, clothing, anything you can come up with to support families having multiple sickle cell warriors. That is what we welcome. So Secret Santa is what is coming up ahead of us this December.
Yeah. That's a great initiative. And how do you measure impact when it comes now the regionals, when you go to the community? What data convinces partners to scale?
Sorry, the network is not steady, so I didn't get your question clearly. Repeat your question again, please, Pius.
All right. How do you measure impact when now maybe you do an activity around your community, around maybe awareness? What data convinces partners to scale into a more broader community?
Okay, we do what we call impact assessments. We do it every quarter. Okay, after every campaign, we do impact assessment, and we have data that we send to those who have supported us to see the impact that we are making with every campaign. So that's exactly, we have it. It's even on our website where you can request for our impact assessment data, and we send it to you.
I'll surely reach out so that I learn more from your side. And when it comes now systems and policy, where it's broken and how to fix it. If you had one policy line to add to the national agenda, what will it be, or what will it say? So if I was asking if you had one policy line to add to the national agenda, what will it say, and how might it impact the environment and other communities?
Okay, if I have any policy contribution to make to the national, it will be to make free health insurance compulsory for every sickle cell warrior. Okay, apart from lending my voice to newborn screening, I equally advocate for those existing warriors to have adequate care. Okay, and that is one campaign I will not stop making, because, like I said earlier, the greatest need of a warrior is prompt access to adequate health care. You can imagine being in pain, being in that crisis, and having to choose between using the little money in the house to feed the family or to take the child to the hospital. It's not a good experience, and I'm talking from my childhood experience, where my parents will have to choose between sending me to hospital and spending the little money at home, and keeping me at home and using the little money remain available to feed the family. So every child living with sickle cell should have access to adequate and prompt health care. So that is what I campaign for, free health insurance for every warrior.
And we'll all reach there, and I support you on that. And moving forward, I think I'll come up with my own decisions too, so that I second your suggestion. And when it comes now, scale and sustainability, partnership and funding models, how do you make pilot projects irresistible to big funders?
Well, like, I said, we've been funding this by my friends, myself, and my company. But at the moment, we have some programs we're trying to roll out. One of them is the podcast we call The Painful Truth. Okay? The Painful Truth. And there's some other programs that we have designed. And we are trying to make the pilots of these programs so that we can approach some prospective partners that we have selected, to see how we can leverage on that and put out our campaigns out there. And you are also one of those that we are looking at. You and I had talked the other day, and we're looking at how we can collaborate, how we can partner, to make our voices stronger, our advocacy, broader than what we are doing at the moment. So we can co-design even programs, look at it very well and see how we can attract funding for those. But after we have made our pilot, and I think that's exactly the more of the things we're going to do in entering 2026. We want to go into a lot of partnership, but those that we have designed already, we're working on making the pilots so that we can, present it out there for prospective partners and collaborators.
Sure, I would appreciate that, because that now that in Kenya, systems fail patients too. There's no treatment, there's no access to care, and that leads patients now face social stigma, face burnout, and it's quite painful. So how did you figure it out to now from education to now saying that education could even be a medicine to these patients using your voice?
Okay, when you talk of education, the one problem we have in Africa is high rate of illiteracy. Okay, so our advocacy is majorly to educate. To educate, first of all, to talk about what sickle cell is really, because there's a lot of misconception, there's a lot of myths surrounding sickle cell in Africa. A lot of families in Africa think that sickle cell is a spiritual thing, okay? And I remember growing up, they gave me a lot of names, a lot of names like in Nigeria, they call Obanje, they call names like Abiku, they call, all sorts of names. And it's not just about the rural communities, even in the cities where you think people are educated, you see that they know almost nothing about sickle cell. Some of them even think that sickle cell is contagious. Some of them will tell their kids not to associate with you because you have sickle cell, because they think it's infectious. Okay, so education is key. Trying to let people know exactly what sickle cell is and what sickle cell is not. Okay, and that's exactly why we're lending our voice. We are very active on social media, especially on LinkedIn, where I have been educating people, about sickle cell disease, what it is and what is not, and also lending my voice to calling on the government to do the right thing. Okay, every human being should know their genotype. Once you're born into this world, you should know your genotype so that to guide you in making informed decision. So these are the education. Then if you talk about we like the campaign we do going to secondary schools, that is another way we do it. We go to secondary schools in Abuja trying to educate our secondary school students on what sickle cell is about and how they can, make informed decision when they start talking about issue of love and marriage. Okay. So education is key to advocating for sickle cell.
I feel empowered through the kind words that you've shared, and as an author of your book, and kindly tell us what you've written about, and will you kindly tell which one chapter should every policymaker read from the perspective of you're the one holding the pen to write your story, as I am holding my pen to write my story. So which chapter will you recommend?
Sorry, Pius, my network tottered, so I didn't hear the whole question. Sorry about that. Please repeat that question again.
Okay, as an author, I believe that I'm the one who is holding the pen to write my story, and you're the one who is doing that too. Kindly tell us more about your book in a nutshell, and what chapter or what one chapter should everyone or every policymaker read?
I must tell you the chapter 2 of my life, chapter 2, which talks about the turning point of my life, the turning point, the points where I realized what sickle cell means and how to manage it. Because people see me today and they commend me that I am taking good care of myself. But it can only be so because I have been educated. I have been trained on how to take care of myself. So I think that chapter is very important because even if you don't know how to take care of yourself, I've had a sad incident where a younger sickle cell warrior I met about 2-3 years ago, I discovered that he was taking alcohol. He told me, Obi, I take it socially, and I try to discourage him from doing that, because alcohol causes dehydration, and dehydration is one thing that you must not subject yourself to as a sickle cell warrior. Okay. And so if there's anything I would like you to write or to read about me and about my history, it's going to be that turning point where I got to be self-aware about how to live as a sickle cell warrior. And that is why after 51 years of my life living with this disorder, I am still here standing. Okay? So whatever story I am going to tell you, right from my birth, from diagnosis until now, the most important is that turning point where I got to realize exactly how to take care of myself, which is what has brought me here, today.
You're truly a Shujaa, and I feel that I have more to learn. Since that I'm still younger, I have still much more to be done, and I would like to partner with you, and I would like to create more change, more meaningful change that systems can at least give patients opportunity to craft and continue holding the pen to write their story.
I don't know why today of all day my network is really giving me problems, but please, we must do this.
Yeah, we will.
The network cannot stop us. So please ask that question again and let me be able to respond.
It's just a call to action from your side, from the perspective of you're now a lived experience expert. You're your own doctor. You're still holding the pen to write your story, and that part is empowering me. So, which kind words will you share out to a person that is feeling empowered through your story?
Okay, I always tell people something. sickle cell is not a death sentence. Okay? It is good that I have outlived some medical doctors who have predicted my death in the past. I have outlived a lot of them. Okay? Some predicted 15, some predicted 25. And here am I today living the double of those age. So what I tell people is that sickle cell is not a death sentence. Okay? I have this slogan I have developed. I said, after all, it is a sickle cell, not a sickled life. Okay? That mindset has given me the strength to thrive, the strength to aspire to become everything I have dreamt about, knowing that it is my cell that is sickled, not my life entirely. Okay? So I take control of my life and I try to strive and achieve all my dreams. So that is one thing I try to encourage sickle cell, every sickle cell warrior out there, that it is not a death sentence. You can live your dreams. Well, first of all, you must take away fear. Okay? Because everyone dies. It's not only sickle cell that kills. Okay? People who are, in quote, healthy, they die as well. Okay? So don't think that every death it's because of sickle cell. No. There are other diseases that kill. Malaria kill in Africa, even than sickle cell. Okay? So many other diseases that are killing more than sickle cell. So please don't be afraid. Take that fear away and strive to achieve your dreams. That is one thing I encourage everyone that crosses my path.
Thank you, Shujaa. And it's been a pleasure. And I've learned that if you want to be your own advocate, it's until you step out so that you start creating. I must say thank you. And looking forward to collaborate with you, looking forward to create more impactful change coming next month, coming next year. Thank you for the opportunity.
Thank you so much, Shujaa. I hope I pronounced that word right.
Yeah.
Thank you so much. And please, I'm always available anytime you need me. And I look forward to that collaboration because that is the only way we can make our voices stronger. That is the only way we can make the government to listen to us. Thank you so very much for this opportunity.
My pleasure. Success on what you're going to do and continue crafting change. Cheers.
Thank you. Cheers. Bye-bye.